Ruling means that employers throughout Greater Cincinnati will have to decide whether they'll continue to offer health coverage to their employees. It won't be required after 2014, at least for small businesses. 9 News reporter Tom McKee is live with the problems all this poses for one White Oak businessman. Tom?
Well, Carol, I talked to dozens of companies today, and they told me they're not sure what they're going to do right now. But what if your livelihood depending on selling health insurance plans? Well, that starts the story of David Cross. David Cross spent Thursday morning in front of a computer waiting for the Supreme Court ruling. After all, he's vice president of United Benefits Agency in White Oak, which provides health plans for small companies. Finally, at 10:30, the flash from ABC News appeared.
In a dramatic victory for President Obama, the Supreme Court upheld the 2010 health care law, preserving the landmark legislation.
It was not the decision that Cross had been expecting.
Stunned. We thought the individual mandate would be held unconstitutional, and the other parts were up for grabs. It's going to change the marketplace forever.
Cross has spent a considerable amount of time reviewing the health care bill for himself, his coworkers, and his clients. So, what's his take?
On the plus side, there'll be guarantee issue of coverage coming in 2014. There'll be no pre-existing condition clause in 2014. Those are positive changes. Negative changes, price, how the rates are calculated.
The largest fear Cross now has, though, is how United Benefits will fare as the landscape changes.
It'll be interesting to see if we're still here, because 60% of our small group clients have already said that come 2014, they would probably not offer coverage because there's no penalty for them to offer coverage. Number one. Number two, the only way their employees can get a subsidy from the federal government is if they don't offer a group health plan and that individual buys coverage in the exchange.
Now, one employer put it this way. Let's say it costs $15,000 a year to provide health care for an employee. Under the new law, if he didn't offer health insurance, he could give that employee $10,000 to buy his or her own policy, pay the $2,000 fine, and come out $3,000 to the better. Tough choices for a lot of firms coming ahead. Tom McKee, 9 News, live in Corryville.
Thanks, Tom.